This is a posterior view, and the trapezius has been removed, and attaching from the superior nuchal line of the occipital bone is the splenius capitis muscle, visualized here, and then the splenius cervicis muscle is visualized inferior to that. Okay, so splenius capitis and splenius cervicis. Deep to the splenius muscles is the semispinalis capitis, and this is attaching between the superior and inferior nuchal line on the occipital bone. Semispinalis capitis. Deep to this muscle, we'll find the suboccipital muscles and the suboccipital triangle. On the left side of this image, the trapezius is still intact, attaching to the superior nuchal line. You can see the greater occipital nerve piercing through the fascia here of the trapezius. Deep to the trapezius are the splenius muscles, which have been removed, and then you have the semispinalis capitis, which has been cut to reveal the deeper muscles, the suboccipital muscles. Okay, your suboccipital muscles are comprised of 4 muscles. Also visualized here will be the vertebral artery, suboccipital nerve, which is dorsal rami of C1, and the greater occipital nerve, which is dorsal rami of C2. This image is from page 17 in Grants, and this has the trapezius has been cut and reflected and removed. The deep muscle to the trapezius is the splenius capitis, and that has been reflected. Deep to that is the semispinalis capitis, and that has been removed as well. And now you can see the suboccipital muscles right here. So these are 4 muscles that attach from the inferior nuchal line to spinous process of C2 and transverse process of C1, and you'll also see these nerves and arteries exiting through this area, suboccipital nerve and greater occipital nerve, occipital artery, and vertebral artery. Okay, this line represents the inferior nuchal line of the occipital bone, and C1 posterior tubercle, C1 transverse processes, C2 spinous, and C2 transverse processes. Attaching from the inferior nuchal line of the occipital bone to the posterior tubercle of C1 is the RCP minor muscle. This is the rectus capitis posterior minor muscle. Okay, just lateral to that is the rectus capitis posterior major muscle. This is attaching from the occipital bone to the spinous process of C2. Okay, RCP major, rectus capitis posterior major muscle. From the occipital bone to the transverse process of C1 is the superior oblique muscle. This is also known as the obliquus capitis superioris muscle. And then attaching from the transverse process of C1 to the spinous process of C2 is the inferior oblique muscle, and this is also called the obliquus capitis inferior. So capitis means head, oblique, so at an oblique angle. This muscle up here is superior, okay, and this one is inferior. Okay, so here's the occipital bone, RCP minor, which is medial to the RCP major, coming down, attaching to the spinous process of C2, superior oblique muscle attaching to C1 transverse process, and the inferior oblique muscle. So these 3 muscles right here make up what's called the suboccipital triangle. The RCP major muscle would be the medial border of the suboccipital triangle. Seen within the suboccipital triangle is the vertebral artery. Okay, so it's quite deep in there, and it continues inferiorly and then into the brain as well, but you can find it in here in the suboccipital triangle. Also seen here will be the suboccipital nerve, and this is a dorsal rami off of C1, suboccipital nerve, and this is what supplies all four of these suboccipital muscles. Okay, suboccipital nerve, so C1. Okay, also seen progressing superiorly, this is off of dorsal rami of C2. This is the greater occipital nerve, and you can also see this piercing the fascia through the trapezius muscle. Superficial to and overlying the suboccipital muscles is the muscle called the semispinalis capitis. And piercing that muscle, you'll see going superiorly is the greater occipital nerve. This is from C2 again, and then inferiorly, you'll see the least occipital nerve. This is actually from C3. Okay, and so this is semispinalis capitis because it's attaching to the head. There's also a semispinalis cervicis, and this is attaching from C2 spinous, semispinalis cervicis. This image is from Ohlinger, and this is the semispinalis capitis muscle with the greater occipital nerve piercing and the least occipital nerve. If you were to remove the semispinalis capitis muscle, you then can see all of the suboccipital muscles and C2 dorsal rami with the greater occipital nerve. Okay, this is the suboccipital nerve, and this supplies the four suboccipital muscles: the RCP minor, rectus capitis posterior minor, RCP major, rectus capitis posterior major, the superior oblique muscle, and the inferior oblique muscle. Okay, deep in the suboccipital triangle is where you will find the vertebral artery. And then also attaching to the C2 spinous and moving inferiorly is the semispinalis cervicis muscle. This is a cadaver dissection from Ohlinger, and this is posterior view. This is the occipital bone here with the inferior nuchal line. This is the C2 spinous. This is the posterior tubercle of C1. This muscle right here is the rectus capitis posterior minor. Rectus capitis posterior minor. Okay, going to posterior tubercle of C1, so this would be the right side, and this would be the left RCP minor muscle. From the inferior nuchal line to the spinous process of C2 and lateral to the RCP minor is the RCP major muscle. Rectus capitis posterior major muscle on the right and on the left. From the occipital bone to the transverse process of C1, superior oblique muscle, obliquus capitis superior muscle. And from the transverse process of C1 to the spinous process of C2 is the inferior oblique muscle, also named the obliquus capitis inferior muscle. So this is the suboccipital triangle. Within that triangle, you'll find the suboccipital nerve with its branches going to those muscles, and then deep in the suboccipital triangle is the vertebral artery. Also attaching from the spinous process of C2, you can see the semispinalis cervicis muscle. This is the greater occipital nerve. Okay, and least occipital nerve. This is the same dissection, just taken from a different angle. So what you're seeing here is almost kind of like you're looking at it in an oblique view. This is the inferior nuchal line. This is posterior tubercle of C1, and the C2 spinous. So you can see RCP minor, RCP major, superior oblique muscle, and inferior oblique muscle. And deep in here, you can see the vertebral artery. So here's the vertebral artery, and then this is the suboccipital nerve. Okay, semispinalis cervicis muscle, greater occipital nerve, and the least occipital nerve.